Imagine this. Your child is in the midst of a mental health crisis, and the emergency room becomes their temporary home for days on end. This is the harsh reality for many families, according to a recent study led by Oregon Health and Science University, OHSU. But here's where it's controversial. The study reveals that the number of kids visiting OHSU's Children's Hospital for psychiatric reasons has more than tripled from 2016 to 2024. And this is the part most people miss. The issue is not just about the increasing numbers. It's about the lack of appropriate care facilities, leading to children being held in emergency rooms far longer than necessary. Let's dive into the details. In a study that analyzed 255,000 visits, researchers at OHSU found that over 1 in 10 Medicaid-enrolled children who seek help for mental health issues in hospital emergency departments end up staying there for 3 to 7 days. This is not because the study, published in the JAMA Health Forum, assessed data from 44 states, indicating that this is a nationwide problem. In Oregon, the situation is particularly dire. Rebecca Marshall, an associate professor of psychiatry at OHSU, noted that in 2016, 150 kids were consulted for psychiatric reasons at Dornbecker Children's Hospital. By 2024, that number had surged to 453. This dramatic increase highlights the growing mental health crisis among youth. Marshall emphasized the impact on not just the children, but also their families and the hospital staff. When you have a child languishing in the emergency department, not able to get the care they need, their condition can get worse, she said. It's demoralizing and overwhelming, especially when you're trying to juggle a lot of other kids who also need care. So, what do you think? Is this a systemic failure? Or are there other factors at play? How can we better support our children in crisis? Share your thoughts in the comments below.